If you have diabetes and you smoke, your doctor has almost certainly told you to stop, but they probably didn't explain exactly what a cigarette does to your blood sugar chemically in real time. That's what this video is about. The short answer is yes, smoking raises blood sugar, but the more useful answer is how, because when you understand the mechanism, this stops being about willpower and starts being about science. The 5 mechanisms. Every time you smoke, at least 5 things happen to your blood glucose simultaneously. The first is the fastest. Nicotine hits your adrenal glands within minutes and triggers a release of cortisol, your body's stress hormone. Cortisol tells your liver to dump stored glucose into the bloodstream, and it makes your cells less responsive to insulin at the same time. For someone without diabetes, that's a small metabolic blip. For someone with type 2, whose insulin response is already working against the clock, it's a significant and repeating disruption. The second mechanism builds over time. Chronic nicotine exposure progressively worsens insulin resistance, the central problem in type 2 diabetes. Your insulin receptors become less effective, your body needs more insulin to do the same job, and your HbA1c climbs. The Fukuoka Diabetes Registry tracked 2,490 type 2 patients and found a clear dose-dependent relationship. More cigarettes per day, higher HbA1c, more years smoking, higher HbA1c. It's not random. Third is tar. Cigarette tar contains hundreds of pro-inflammatory compounds that raise your levels of CRP, TNF-alpha, and other inflammatory markers. Chronic inflammation directly impairs insulin signaling at the cellular level. A diabetic already carries a higher inflammatory baseline. Tar adds to it, making glucose control measurably harder from the inside. Fourth is carbon monoxide. CO binds to hemoglobin 200 times more tightly than oxygen, so less oxygen reaches your muscles, kidneys, and heart. Under that oxygen stress, your cells shift into a less efficient metabolic mode, which places additional strain on glucose regulation. For a diabetic whose circulation is already compromised, this compounds an existing deficit. And fifth, the one most people have never heard of, is carbonyls, formaldehyde, acrolein, acetaldehyde. These reactive compounds in cigarette smoke generate free radicals that directly damage the pancreatic beta cells responsible for producing insulin. In type 2 diabetes, beta cell function is already declining progressively. Carbonyl-driven oxidative stress accelerates that decline. So, every cigarette is hitting your blood sugar from 5 directions at once. The numbers. The clinical data is consistent across populations. For every 20 additional pack years of smoking, HbA1c rises by approximately 0.12%. Flip that around. Sustained smoking cessation over 1 year produces a 0.7% drop in HbA1c. That is roughly equivalent to adding a second diabetes medication, the same glycemic benefit, simply from stopping. In India, the stakes are particularly high. We have around 89 million people living with diabetes, the second largest diabetic population in the world, and approximately 100 million cigarette smokers. These two groups overlap substantially. South Asian bodies carry a genetic predisposition to insulin resistance at lower body weights than Western populations, which means Indian diabetics are already metabolically more vulnerable. Smoking on top of that isn't additive, it's multiplicative. A note on Smoke Safer Gold. We want to be honest about something. If you're not ready to quit today, that is a real and common place to be. Cessation is a process, not a single decision. Smoke Safer Gold is a 5-stage reusable cigarette filter with activated carbon, independently lab tested to reduce tar by 70%, carbon monoxide by 71%, and carbonyls by an average of 75% per cigarette. Those are the compounds behind mechanisms 3, 4, and 5-0. The inflammation, the oxygen deficit, and the beta cell damage. We're not saying a filter replaces quitting. It doesn't. But for smokers who are working towards cessation or reducing, it's a way to lower the harm from each cigarette in the meantime. The lab data is on our website, smokesafer.in, and we'd rather you read the numbers than take our word for it. Close. Quitting smoking is the single most impactful change a diabetic smoker can make for their long-term health. The clinical benefit is real. it's measurable, and it's available to everyone who gets there. If you're ready to start that conversation, talk to your doctor. The National Tobacco Quit Line, 1-800-112-356, is free and available Monday to Saturday in Hindi and English. If you're not ready yet, that conversation is worth having honestly too. Understanding what's happening in your body is always a useful first step. We have a full written guide at the link below. And if you found this useful, subscribe. We cover the science of smoking and health every week without the lectures.